Hello, everyone, and welcome back to another episode of our 100 clinically oriented anatomy questions. This is question 47. Let's get straight into the video. The question says a 22-year-old man is admitted to the emergency department after falling from his bicycle. Radiographic examination reveals a fracture of the tibia above the ankle. MRI and physical examination reveals that the tibial nerve is severed on the posterior aspect of the tibia. Which of the following signs will most likely be present during physical examination? So, okay, just sensory loss on the dorsum of the foot, sensory loss on the sole of the foot drop, paralysis of the extensor digitorum brevis, sensory loss of the entire foot. So the question basically is telling us that there was a cut basically, a cut to the tibial nerve in the posterior aspect of the tibia. So what's going to happen? Let's check the options one after the other. Sensory loss of the dorsum of the foot. So the dorsum of the foot is majorly supplied by the superficial peroneal nerve, right? And it's the first interdigital cleft is supplied by the deep peroneal nerve, basically. So they don't have anything to do with the tibial nerve, basically. So option A is not definitely correct. Sensory loss of dorsum of the foot cannot happen. There's going to be a sensation on the dorsum of the foot, and it's not lost, basically. So because the peroneal nerves are not injured, basically. So sensory loss on the sole of the foot. Now the tibial nerve divides or bifurcates into the medial plantar nerve and the lateral plantar nerve, and the medial plantar nerve and the lateral plantar nerve supplies all the muscles of the sole of the foot and also give cutaneous innervation to the sole of the foot. So if the tibial nerve is injured, the medial plantar nerve and the lateral plantar nerve will definitely be injured automatically. And then there will not be loss on this, there will not be sensation on the sole of the foot. So it means there will be a loss in the sensation on the sole of the foot. So that is option B. I believe that's pretty straightforward. So that's option B. Then foot drop. Foot drop is an injury to the deep peroneal nerve. That is the loss of dorsiflexion of at the ankle joint. So deep peroneal nerve, that's the peroneal nerve, does not have any business with the tibial nerve. Paralysis of the extensor digitorum brevis. So there are majorly two muscles on the dorsum of the foot: the extensor digitorum brevis and the extensor hallucis brevis. And both of these muscles are supplied by the deep peroneal nerve. They don't have any business with the tibial nerve. Sensory loss of the entire foot, that's not possible. It's only the sole of the foot that you are going to have a sensory loss. The dorsum of the foot is still going to be very well okay because the peroneal nerves were not affected. So the correct answer is option B. And I believe you understand it. You understand and you enjoy the video. Please make sure you like, make sure you subscribe, make sure you comment, and I will see you in the next episode. Bye.